sometimes you have to open up all the wrong doors before you decide to open up the most obvious right door.
Yep.
So
glowing lights around the outside.
Exactly. It says everybody else did this and was happy.
Welcome to the Ask an Audiologist podcast, real audiology white papers written by real audiologists and explained to you by a real audiologist and a guy who isn't. Now, here are your hosts, Dr. Michael Squires and Kevin Ziener.
In honor of it being Labor Day, we worked hard to bring you a brand new episode of Ask an Audiologist. I'm Kevin Ziener.
I'm Dr. Michael Squires.
Today we are going to discuss what I assume is the second, maybe first most asked question that audiologists receive every single day in their practice. What is the best hearing loss treatment? Written by Dr. Elizabeth Orlando of Ontario Hearing Centers. I have a feeling I know the answer to this, Michael, but for content's sake, Dr. Michael, tease us a little bit with things that might not be the best hearing loss treatment, and then get into what is in fact the best hearing loss treatment.
The best hearing loss treatment that money can pay for is the clear, and the clearest, most concise way is to say that it's vague. And so it's a great way to start. Is let's start by talking about what's not a good option for you, right?
Perfect.
And so let's say that you are suspecting that you have a hearing loss, and you're sitting at home and you see that TV commercial that comes on and go, well, that looks tiny.
Yeah. And
you order it online. Probably not your best option.
For sure.
I have patients that come in all the time that say, I ordered it out of Sky Mall. Yep. I ordered it out of a Reader's Digest, or I got it offline or something like that. Mm-hmm. And it's just not working for me. Well, there's probably a reason for that. The majority of the hearing aids, up until recently, the majority of the hearing aids that could be purchased out in the
via
universe,
magazine or via TV show at midnight,
exactly,
aren't probably indicative of what you would receive from a professional.
Well, they're generally not prescription. They're going to be like a linear hearing. They're going to be an amplifier. Yeah. And there are some appropriate uses for an amplifier, but you end up overpaying for something that's just a glorified amplifier.
True.
And so not always the best option. Look, hearing loss is a medical issue. I'll stand by that. I'll die on that hill, and it should be treated as such. Mm-hmm. Now, there are ways to save money.
Sure.
There are options for patients who need some assistance. Mm-hmm. Please talk to a professional. If you don't get the answer that you're really comfortable or satisfied with, go to another professional, get a second opinion. Yeah. I feel very confident that most audiologists are able to help patients with a hearing loss, and I see it online all the time. Hearing aids are very expensive. And I totally get that perspective. It's not untrue, but saving money on buying something online is not going to be your best option, because it's not going to treat the hearing loss appropriately in most cases, and B, it's you don't have a professional there to help you with fit and ensure that it's working properly and all of those things.
I was going to say, if you think hearing aids are too expensive, which that is your opinion, and you feel that going to CVS or Best Buy and buying an over-the-counter hearing aid is right for you, then in fact, you get what you pay for, which 100%. Is you found yourself to Google. Dr. Google told you what you may or may not have based on what you decided to tell it.
Yes, exactly.
There's no internal workings of your ear. Mm-hmm. And then you went to Best Buy after searching some Consumer Reports reviews of an OTC. You asked the fine woman or gentleman behind the counter, I want that. They gave it to you, and then they said, best of luck.
See ya.
So if that's worth the savings, so be it. Yeah. But then don't be surprised when it doesn't work.
Hey, absolutely. And let's create a distinction here real quick. So I was talking about devices that were not labeled as over the counter, but you mentioned it, and it's a good point. Recently our federal government created a new, and the FDA created a new category of hearing aid, over the counter hearing aid, and this was introduced to create a little competition for the hearing aid market. And what our consumer research tells us is that price is not always the most important hurdle for not treating the hearing loss. But regardless of that fact, now we have this extra category of hearing aids. So what it does is it relies on the patient, like you're saying, to be able to self-diagnose and then self-treat. Yeah. So basically what you get is the user guide and
any YouTube tutorials, right?
Yeah, user guide receipt and a YouTube tutorial, right? And so I still recommend going to a professional. And there are a lot of audiologists who are working with over-the-counter hearing aids because we have the best interest of the patient in mind, and what we really want to do is make sure that the patient is appropriately treating their hearing loss. And again, they should be able to tell you, an over-the-counter hearing aid, will it save you a little bit of money? You get what you pay for. So you might still be paying $1,200 or $1,400 for a set of over-the-counter hearing aids, but now it does carry a prescription. It's a very generic prescription. I mean, think about it in terms of like glasses, for example. You can go to an optometrist and you can get prescription glasses, or you can go get readers. They have a prescription in them, but is it exactly the prescription for you? Maybe not.
Got it. So as we think about that, and as there's more power in the end consumer's hand, the end patient's hand. That's never a bad thing. Options are never a bad thing, right? Sometimes you have to open up all the wrong doors before you decide to open up the most obvious right door.
So glowing lights around the outside.
Exactly. It says everybody else did this and was happy. So when we think about this pressing question of what is the best hearing loss treatment, as it relates to you, a medical licensed audiologist, in your opinion, which is just an opinion, what do you believe the best treatment is?
So real quickly, not a medical physician. So just a quick clarification. We are licensed audiologists, of course, but we do work with medical physicians. Sometimes medical clearance is required or is appropriate for some patients. But back to the question, what's the most appropriate treatment for my hearing loss? The question is, I don't know. The answer is, who knows? Until you actually go through the appropriate steps for evaluation and diagnosis, right? And so for each individual person, I couldn't look at somebody on the street and go, hey, you know what would be perfect for you? And that's really, really difficult. But you go through this process of, and we've talked about it in other podcasts, you check those big boxes. We're making sure that there's no major overlying or underlying medical issues, right? That's your primary care doc. That's ear, nose, and throat or otology or something like that. And then we're being evaluated by an audiologist. And so the audiologist is going to be the one to tell you, this is the type, degree of your hearing loss, and this is what's most appropriate in treating your hearing loss. Maybe that's an over-the-counter hearing aid, right? Now, over-the-counter and prescription, those can both be simultaneously appropriate. And in some cases, over-the-counter is not going to cut it. And in some cases, hearing aids in general are not going to cut it, right? We might be talking about something like an implantable device. Maybe it's osseointegrated, something that is integrated with the mastoid bone. Maybe it is a cross hearing aid, contralateral routing of sound. We're taking sound from an unusable ear with no residual hearing and sending that sound signal over to the better ear. Maybe it's a cochlear implant. So there are lots of things that can be appropriate for treating hearing loss. It just really depends on the patient, the hearing loss, and what's caused that hearing loss.
Did you ever have a patient where you thought, like, I'm almost positive I know what the issue is, and then you ran the battery of tests and were like, whoa, I could not have been more wrong?
This past week, I had a patient come in, checked all the boxes, noise exposure. I can hear people, but I can't understand what they're saying. 13 years as working in construction around heavy machinery, and I'm going, no brainer, noise-induced hearing loss, right? I see it all day, every day. Tinnitus, ringing in the ears, a little bit of oral fullness as well. Sound sensitivity, like he's got all of these things. And it's noise-induced hearing loss. It's not. He had completely normal hearing. Completely normal hearing. I couldn't believe it. I was flabbergasted.
Crazy.
And so, then we start talking about, okay, now we need to start talking preventative. Right? And so if you want, I have no issues with prescribing and treating normal hearing sensitivity with low gain hearing aids. It can be very appropriate. I like to trial that with every single one of those patients because you don't know until you try it, right? So we'll demo them in the office. We'll send the patients out for a week or two, making sure that they're going to be in those difficult listening environments, right? Restaurants and around their coworkers and things like that. And also wearing hearing protection around loud sounds, right? But yeah, that was a total reversal for me.
And so now that you know the answer, which is It depends.
Yeah, exactly.
You can feel free to go research this topic and many, many more on askanaudiologist.com. So, Dr. Michael, I think you answered it in the exact right way, which is
schedule an appointment.
It's an individual thing.
You got it.
And really, your hearing loss is your own.
You got it.
Thank you so much.
Thank you.
We'll see you guys next week.
Take care.
You can find more information at askanaudiologist.com, and you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only and does not substitute for professional medical advice.
Today, Dr. Jordan is going to be diving into the wonderful world of medical-grade hearing aids. What are they? What do they do? Are they made in a factory by an eccentric man in a purple suit with an army of singing and dancing little people? Stay tuned to find out.